many people ask me when I am about to enter inside the operation theatre to perform some major brain surgery, like say, or major spine surgery like a difficult spinal tumor, what are my thoughts? And some of my friends have also asked this. Some patients ask me, some reporters have asked me this question. And I think it is a very important thing to know. What is a surgeon's mentality when he is about to enter operation theatre to open someone's brain, operate on the brain with the aim of curing this person? And let me tell you very frankly that definitely I have concerns when I'm entering inside the operation theatre. The concerns are about this person's life, this person's family. I know that there are relatives of this person who are sitting outside the operation theatre. They are justifiably worried about what will happen. At the same time, I have to make sure that these emotions don't weigh too much on my mind such that they will affect my performance. So it's a very fine balance when I'm entering inside the operation theatre. And when I start the surgery actually, then I'm fully focused on the surgery. But every now and then, during the surgery, when I have to take a particular decision during the surgery, because while operating, sometimes we have to take on-the-spot decisions. So every time I take such a decision during surgery, I remind myself that this is a person with a family, with a spouse, with children, with parents, and my job is to give this person back to them, and then I take the decision. So it's a very fine balance. I think the ego of a surgeon, every surgeon has got justifiable ego because of the number of years and experience and the expertise. And I must say that I also do have a justifiable ego in our team's ability, because without that you cannot function. And let's not call it ego. I think it is more of a confidence, let's say, that is there. But this confidence should not make you take some steps which are risky, too risky. So in today's era, when we are operating, we are more tilted towards safety of the patient, along with the efficacy, of course. Our aim is to cure permanently, not to give some short-lived answer. But this is the mentality in which I am in while I am entering inside the neurosurgical theatre. At the same time, I am quite confident that the cases that I operate, I have about 25 years experience behind me, and I know the variations which I would face while operating. I know what decisions need to be taken in that particular instant. So that experience is behind me, it is helping me, and that confidence is always there. Also, very important to remember that unless your operation theatre is fully equipped for that particular surgery, you should not perform that surgery. At least this is what I follow in my practice. You should have world-class instrumentation. You should have world-class assistants. You should have the world-class atmosphere in the operation theatre. And then only you should embark on that. So that is something which I ensure before, I enter the theatre. I ensure that all the equipments are ready and functional. So these are the thoughts uppermost in my mind while I am entering the theatre. But as I start surgery, as I told you before, my focus is entirely on the procedure of the operation, and that focus is required for the delicate neurosurgeries to cure these people.